take advantage of the many types of breathing methods, especially deep breathing methods, that are available to us to maximize our ability to expirate or cough up mucus or phlegm that's in our lungs and get them out of our body. So we're looking at shortness of breath, congestion, dry coughs, cystic fibrosis, anything where we're having a collection of fluids inside the lungs and we want to expirate or cough them out. So we're going to look at 3 types of breathing methods, and we're going to select a breathing method which gives us the most capacity to have air coming in and out of our lungs, and also the same method will automatically straighten our body to give a straight path physically for the fluids to come up out of our lungs and out our body. So to begin, I'm going to just use the example of just a sponge, and actually the lungs are sponge-like as well, and use this as a visualization to help us understand the different methods of breathing that we're going to be looking at. We're going to look at 3 types of breathing: chest breathing, abdominal breathing, and breathing from the abdominal floor. The first type is chest breathing, and if we place a hand on our chest, breathe in and out with our chest, you can feel the chest expand and contract. Expanding on the in-breath, contracting on the out-breath. If we continue to do chest breathing, you can feel the muscles in the chest, neck and shoulders begin to fatigue as they're being used. This is one of the problems when we have shortness of breath, is that the muscle fatigue from the breathing process fatigues the body. Using the sponge as an analogy of the lungs, for the chest breathing, as we exhale, the lungs compress, then we inhale and they expand. On the exhale, they compress. On the inhale, they expand. The second breathing is abdominal breathing, and this type of abdominal breathing, we're going to use a visualization process of breathing through the navel or the belly button. So if you place your hand over your navel or belly button and visualize that you're breathing in through the navel or belly button and exhaling through the navel or belly button, you will feel your abdomen expand on the inhale, breathing in through the belly button, then exhaling through the belly button, the abdomen contracts. Again, breathing in, you can feel the expansion. Relaxing, you feel the contraction. And this is abdominal breathing. If you place your hand on the chest, if you place your other hand on the chest, for abdominal breathing, the chest shouldn't be moving. So I breathe in through the belly button. The hand on the chest is still. Relaxing. The hand on the abdomen goes down. The hand on the chest remains still. Again, abdominal breathing. The hand on the abdomen rises with the expansion of the inhale. The hand on the chest remains still. You can do a continuation type of breathing of abdomen into chest breathing by beginning with an abdominal breath And then continuing into a chest breath. And then relaxing. Inhale through the belly button first. Then continue the inhale with the chest. And you'll have both hands expanding on the inhale. Both hands contracting. This is a longer or a more full type of body cavity breath. You can notice the volume difference when we do just the chest breathing just the abdominal breathing, then the abdominal leading into the chest breathing combination. Now the third type of breathing we're going to do is going to be from the floor of the abdominal cavity. And to get the feeling of the floor of the abdominal cavity, it will be the part of your body that's rubbing against the chair. Your buttocks or butt is rubs against the chair, and that's the floor of the abdominal cavity. So now to breathe from the floor of our abdominal cavity, we're going to use visualization, just like we did with the abdominal breathing. And we're going to use a deep sigh to get to the place of the floor of the abdominal cavity. So the exhale will be a deep sigh, and we just sigh and keep a follow through of the sigh going until you can feel the exhale hit the floor of the abdominal cavity. So I'm going to just do a deep sigh, keep it going, and I could feel the floor of the abdominal cavity. And that's the first half, or the exhale, of our abdominal floor breathing. Then for the inhale, we're going to start at the floor of the abdominal cavity and inhale, and the visualization we're going to use is a yawn. So we're going to open our mouth widely as though we're yawning and feel an inhale triggered by the opening of the mouth widely. So first we'll sigh and we go then we'll open our mouth widely from the floor of the abdominal cavity, and you'll feel that you did a complete in-breath as soon as you opened your mouth widely, and you can feel it come from the abdominal floor all the way up through the abdomen, and we can continue that expansion into the chest. So we're literally doing an abdominal floor, abdominal, and chest breath all in one series or cycle of motion. So we'll do the sigh, the exhale. I can feel this chair seat. Now I'm going to open my mouth quickly, and I breathe in from the chair seat up through my abdomen and allowing my chest to expand. One more time, and this time feel the volume of air now that we're incorporating into our breath cycle. So we're going to sigh, hit the chair, yawn from the chair, open the mouth wide, and you can feel the volume of air that we have with this almost complete body breathing. With the sponge, it looks like you sigh all the way to the floor of the abdominal cavity for the exhale, so you're going and now when we open our mouth wide to yawn, we go and inhale completely. Again, just sigh feel that exhale compression on the lungs. And then when we open our mouth widely, the lungs pop open or spread. Now what you also need to notice is that this is instantaneous inhale. That at any time, if we open our mouth widely, we can take a full abdominal floor inhale. So at any time of an exhale, so let's just exhale from our chest a little bit. So we just exhale and then open our mouth, and you notice that you can take a full in-breath from the floor of your abdominal cavity up, but it happens as soon as your mouth opens. So let's do it again and exhale to our abdomen. So we exhale to our abdomen and then open our mouth wide, and you can inhale from that abdominal floor up, and you just did a full complete inhale. Now where this is going to be important in our respiratory therapy is that as we're squishing the lungs around with an exhale, we're loosening up the mucus or phlegm. And then what happens when mucus or phlegm loosens up, it constricts the pathways of the lungs, so you start to choke because you can't get air because you got this phlegm and mucuses all loosened up, and you have this choking feeling and you can't breathe, literally, and naturally you start to panic because you can't breathe. So what this instantaneous inhale does is it gives us the security that as we're mixing this phlegm and mucus up, at any time we can allow it to collect, and when we want to inhale completely and get air, all we need to do is open our mouth wide, and we can instantly eliminate that feeling of aphixziation. And this is a vital part of this type of therapy, is we are fighting against the choking, the aphixziation of all this mucus and phlegm anyway. When we start to collect it so we can expel it out, naturally we got more of it going, and that choking feeling, shortness of breath is now increasing naturally because we got more. So we need the security that we are not going to choke. We are not going to asphyxiate ourselves, and have the knowledge that we can breathe or inhale completely at any time that we want to in this coughing up type of process. So this mouth opening widely as an inhale is a valuable part of this type of therapy. So even like right now, all you need to do is just open your mouth real wide, and you feel the inrush of the oxygen throughout your body instantaneously. So just practice it once or twice. Just sit there, or if you're standing there, stand there, and just open your mouth real wide, and you can, from the floor of your abdominal cavity, fill the body up completely with air. It is a huge breath. So if you're having shortness of breath at any time, you could open your mouth real wide, like you're yawning, right? You yawn, and you can get a full breath of air. Now, what also is important with this physically is that this inhale from the abdominal cavity, you'll notice that when you open your mouth wide or when you yawn, your back goes vertical. And that enhances the breathing process. It also enhances the blood circulation as well. So any benefits from having an increased blood circulation or a vertical spine or vertical abdominal cavity are all benefiting from this inhale, because the back is naturally going to straighten itself with this inhale. You'll also notice that as we did all this breathing, our neck and shoulder muscles didn't tighten up, our chest didn't tighten up, and that's because we're not using those muscles to breathe. We're using this flow of energy as the source of the breathing instead of the expansion and contraction of these muscles up here. So visualization is an important tool in this respiratory therapy as well. Using the analogy of the sponge, this is chest breathing. This is abdominal to chest breathing. This is abdominal floor breathing. Keep it going. Squish the lungs. And then open the mouth to inhale. Squish those lungs. Open the mouth to inhale. Now, to use this deep breathing from the abdominal floor to help to expirate or cough up the mucus and phlegm, we're going to, on the exhale, we're going to visualize that as we exhale, we're compressing the lungs. And you can even imagine that you're shaking them up a little bit as you're exhaling, and you're trying to loosen up the mucus or phlegm. So just do shallow exhales, shallow sighing, all the way to the floor of the abdomen. But concentrate on that visualization that the lungs are compressing. And then just inhale from the floor of the abdominal cavity, but do it just slowly, and visualize that you're bringing clearness into the lungs. So you're squishing on the sigh, and then as you slowly inhale, you're bringing air or clarity into the lungs. And then as the process continues, you'll feel the mucus or phlegm is starting to gather, and you're going to feel like the need to cough. So if you could suppress that need a little bit, it means that you have more chance to build more mucus or phlegm up with the breathing. Or it could be that almost right away you start to loosen up something immediately and get that urge to cough. So the fear is going to be if at the end of the exhale you're going to have to cough it up, but the exhale is how you cough. So you have to do a quick inhale, and now your body has enough oxygen that you can wait a second, and then when that urge to cough hits, then you cough. And this is why that ability to inhale at any time gives you the security that you can work the mucus and phlegm up, get the feel that you might have, feeling that you're going to cough, and then inhale And now when you exhale for the cough, you're exhaling from the floor of the abdominal cavity for a full body cough. So I'm going to just slowly sigh, work the lungs, inhale, feel, visualize they're clearing up, sigh, work the lungs, visualize that they're clearing up. So I'm going to sigh, compress the lungs, work the lungs. Then slowly inhale or just relax from the floor of the abdominal cavity. Visualize the lungs are getting clear, filled with air. They're getting clean. I'm going to sigh again, compress the lungs. Inhale, cleanse the lungs. Sigh, working that mucus up a little. Inhale, cleaning, sighing. I can get this cough almost starting, and then I'll inhale, try another complete exhale, see if I can work some more mucus up, and then I'm getting closer to having the cough, and then did a little inhale. And if on this next time I have to cough, you're going to see me do a wide open inhale, now on this next time if I have to cough, you'll see I'll do a wide open mouth inhale so I can get air, and then I'll exhale for a cough from the floor of the abdominal cavity. You have to have your Kleenex ready. And you could see how when I did the cough, it came from the floor of my abdominal cavity up. I went vertical and then coughed the phlegm and mucus out. But you could see the length of that cough, the exhale, the cough, how long it was, and also you could probably hear the sound of how powerful that exhale was as well. Also you could see me like playing around with the exhale, building it up, building it up, building it up, and then having the security that at any second, if I need to, I can always do a big inhale. I do the big inhale, and then you notice I was holding it, because the longer I hold that big inhale, the more time I have the mucus to collect, so that when I do the cough, the big exhale, then I can cough it out. So you'll see me get my air, I'm letting that mucus collect, and then I do the big cough. We'll do it again. So I'm exhaling, and then inhaling, exhaling, then inhaling. Keep in mind that if you're really congested, it might be just one exhale and you're ready to cough. Or it could be you'll be in the middle of the exhale and you'll have to cough. And if you're in the middle of the exhale, like, and you have so much congestion, right now you have to cough, it's immediately open your mouth, get your full breath of air, and then cough. And then you'll get that full expiration of air out and mucus out. So it could be at any time of that cycle, you can quickly just open your mouth, inhale, and now your body can relax because it's got air. With the inhale, you're not choking, and then you can either wait or immediately do the exhale for the cough. So this ability to catch that immediate inhale is vital because it gives you a sense of security that you're not choking yourself or you're not asphyxiating, and that you do have control over your body and this whole process as well. You'll also notice that after you do cough, it's sort of fatiguing because you just did a big cough, but it's not as fatiguing as when you're trying to labor to breathe. So not only does your lungs clear, but there is a sense of relaxing in that your neck and shoulder muscles aren't being fatigued with this type of therapy. Therefore, if you're weak because of shortness of breath, this therapy is ideal because you're not using so much of your muscles to do the breathing. You're using a visualization breathing technique, because you're using a visualization breathing technique. So again, we'll try this again. I'm just doing the exhale, sigh, compressing the lung, and starting to collect already. Just did a normal in breath, and then maybe this, if I have to cough, then you'll see me take the big open mouth in breath. So I'm going to exhale again, squish things around, really follow through and squeeze my lungs. I'm just going to do an in breath normal because I didn't need to cough all the way yet, and I'm secure that I can always take that big in breath. Again, exhale, squeeze it down, and I'm going to just do a regular in breath because I think I can build this up a little more. Exhale again. I think I can do one more. So I'll do another exhale. Just keep exhaling. And expirate some mucus. Of course, this isn't the most prettiest thing to watch, but I could make it look more visually acceptable if I was pretending, but then you don't get the real effect, and then you also won't get to see the ability to hold off on the cough, because I don't have the fear of asphyxiation, because I know I can take that in-breath to start the process at any second. Also notice that when I take that big in-breath, right, I don't cough, and I'm actually calmly waiting for the moment when I'm going to do the big cough, as opposed to panicking and trying to breathe and cough and inhale all at the same time. So hopefully you can see that as hopefully you can see that there is control in the situation, even though that the coughing process is rather violent, so to speak, because of the huge amounts of air that are coming up. And that's another reason that I wanted this to be like a live cough, is so that you can see the volume of air that comes out in a real situation, and also the calmness there is in the control, and also for you to see that you can resist the choking feeling a little bit to allow things to collect a little longer, because you have the reassurance that you're not choking, that at any moment you can catch your breath or do an inhale. And as soon as you do the inhale, you feel the body, in a sense, relax. And then when you do the exhale cough, again, there's an emphasis that it comes from the floor of the abdominal cavity up. And that's the technique. I didn't need to take a lot of recovery deep breaths. My body's relatively calm and relaxed, and you notice that I was able to continue to do the respiratory therapy one breath after another, because I wasn't using that much muscles. It's the visualization process of this particular breathing technique that makes it less fatiguing than a forced kind of breath, and also a forced kind of cough. The cough occurs naturally because you have to cough because of the fluids that are accumulating. So I'm not like trying to purposely work it up, other than on the exhale, just using the power of the contraction of the lungs on the exhale to force the fluids into a position where they can be expirated or coughed up. So this works really good when you're really sick, or you're worn out, or you have shortness of breath, and you need to clear some of the congestion out. You can continue doing the process over and over, and you'll notice that after a period of time, it might take like 15 minutes, it might take a half an hour, but you'll notice that it gets harder and harder to work up the mucus from the lungs, so you know you're getting less and less. Again, depending on the degree of the congestion, also means how long it's going to take to get to that point, but it is a method where you can clear the lungs, and even if they do fill back up sort of quickly, at least you're getting a respite from the exhaustion of trying to breathe, and at least for a period of time, even if it's small, you'll be able to breathe without having the labored breathing. This gives your body a chance to rest. It also gives the muscles a chance to recover as well. So you can keep in mind that just doing this abdominal floor breathing as a normal method of breathing anyway means that you're expending less energy in the breathing process. So it makes the ability to hang on to the breath much easier, less fatiguing. Also, the fullness of the breath cycle aids in the amount of oxygen with each breath that's taken, but also important is that as the body is expanding, with this big inhale, you're expanding all the body tissues as well. So you're making it easier for the blood to circulate. Also, as the backbone is straightening with this breath cycle, you are taking tension away from the muscles, and you're also freeing the abdominal cavity up from constriction because of being bent over. So the entire body now can function easier and in a way that is normally designed to function. I think one of the most beneficial side effects is the relaxation of the body with this breathing process. The straight back allows the neck and shoulder muscles to relax. The straight back also allows the entire body to breathe and move easier and more balanced as well. So the increase in body relaxation is also influential in relieving tension and stress, which you should notice as soon as you start to do the breathing method, is that tension and stress should subside.